Richard Busch here. This is our next installment in our blog for the American Chiropractor magazine at theamericanchiropractor.com. You know, we deal with all kinds of different problems in my office, but one of the interesting things for me, I've got a new doctor that I'm training, and it came up the other day that one of the things that they're going to have to start doing is portraying themselves with a lot more confidence. And a lot more confidence not only in the treatment techniques that they use, but in their abilities as a doctor. You know, I've seen all kinds of different patients during the course of my career, and I've noticed one thing, and that's the more I believe in what it is that I'm doing, the better results we have with the patients, and the more likely they are to start care. We also see an increase in the volume of our practice as we have confidence in not only the techniques, but the procedures and our abilities as a doctor. So this is something that becomes vitally important when if you are ever considering going to a cash type of a treatment basis, but it's also something that's important just from an overall procedural basis when you're dealing with any type of a patient. I know that because that's something that I deal with on a day-to-day basis. You know, the patients that I am very, very confident that I can help, they can feel the fact that I'm confident that I can help them. And if there's a question in my mind as far as whether I think, you know, hey, I don't know whether I can really help this patient that much, they can also feel that. And so, especially because I do work from a cash basis, I have to be very aware of that. But that's not something that's only necessary in a cash type of a practice, because if you're working on from an insurance-based standpoint, the patients that actually accept care and buy into the fact that you can help them, they're going to either do what you tell them to do or not do what you tell them to do based on whether they actually believe what you're telling them and they believe that you believe it as well. So when it comes down to it, if you're not very confident about what it is that you're doing or about your abilities, you're going to have to find a way to actually fake it until you do make it, which is what we used to say in school. But along with that, I think it's also very important to make sure that you're doing everything that it is, whether it's attending seminars on different types of treatment techniques, or on neurology, or you know, orthopedics, or anything else out there that you may need to boost your own self-confidence and make sure that you are the best doctor that you can absolutely be. If you're not willing to do that, then you're probably going to continue to struggle. If you're not doing that right now, you're probably already struggling. So I think it's very important to make sure that you're always doing everything that you can to continue to advance what your abilities are and what your confidence is. And once you understand from a confidence standpoint what it is that you're doing and why you're working with these patients that you're working with and what your expected outcomes are going to be, you can actually be more confident, first of all, that patients are going to be drawn into your office, but then at the same time, that they're going to be more interested in taking care. And with that, you're going to have a higher degree of success with each and every one of those patients. So make sure that you're actually spending time, and you may also want to just do some affirmations in the morning talking about how great of a doctor you are. If you're not doing that already, it's at least the first step. But your attitude and your confidence level are actually vital, not only in whether patients take care, but also in their response afterwards. I want to thank you again for your time today. This has been our blog for the American Chiropractor magazine at theamericanchiropractormagazine.com, or theamericanchiropractor.com, I'm sorry. It's theamericanchiropractor.com. If you have any questions, please be sure to forward them to me. You can forward them to info@allcashpractice.com. I'm Dr. Richard Busch. Thank you for your time. I'll look forward to seeing you again next week.